Hi, thanks for watching SF Live. This is Arnel Valle. I'll be your host for this evening's edition of SF Live. It's a nonprofit focusing on the Department of Public Health HIV Prevention study. I'm joined in the studio with our guest, Dr. Albert Liu from the Department of Public Health. Very quickly, Dr. Albert Liu is currently the Director of HIV Prevention Intervention Studies for the San Francisco Department of Public Health. I'll just call it the DPH.
Great.
It's a lot easier. You're also currently the co-principal investigator on a CDC-sponsored Phase 2 study on, help me with this, tenofovir.
Tenofovir. Right.
And you're also working on a Phase 3 clinical trial on Truvada.
Correct.
Phase 3, as you just told me, is a larger testing for the efficacy or efficiency and safety of an HIV prevention drug. Is that correct?
That's correct.
Wonderful. We're going to move ahead. Our focus today is about HIV prevention studies. It's very specific. There's recently been an ad campaign, mostly in Muni stops. We have a sample of the graphic that's going to come up soon. It's a focus on preventing HIV infections.
That's correct.
And your focus is on high-risk group behavior?
Our focus is on men who have sex with men who are sexually active.
Okay.
And HIV uninfected.
Okay. And you're conducting this study through the Department of Public Health. DPH does research. Is it clinical research?
It is clinical research.
Okay.
So we're based in the AIDS office, the HIV research section, and our goal is to conduct innovative research to find ways that will best impact in the fight against HIV.
Okay.
And so we do studies like HIV vaccines as well as PrEP studies, which we'll be talking about today.
Okay. About the research, so it's not so much collecting information that goes back to the CDC with the number of infections and number of high-risk behavior that could lead to infection, but your focus is on clinical research, drug development that can help prevent people that may be exposed to HIV from getting an HIV-positive result. Is that correct? Is it close?
It's very close. So we do conduct clinical trials on different products that could be helpful in the fight against HIV. And in the study that we'll be talking about today, the PREPARE study, it's a drug that's already been licensed for treatment of HIV. It's a medication called Truvada. And this medication has been used widely around the world for HIV treatment. But the idea is now to see whether this particular medication could also be used to prevent infection in the first place.
Now, when you mention treatment, using Truvada as treatment for HIV, I'm only guessing, so help me out here, that means people who test HIV positive, they have HIV, they're infected with HIV, Truvada is used to keep the virus under control so they don't get sick.
That's correct.
Okay. The study that is being conducted right now is actually targeting people who are not HIV infected.
Right. Who are HIV negative.
Who are HIV negative, so they're not infected.
Yes.
And you're trying out this drug for the goal of using it as almost like a vaccine.
Yeah, it's sort of like a vaccine. Typically, people think of shots when they get vaccines, and
like a flu shot.
Like a flu shot,
right?
And so this is a little bit different in that it's actually a pill that people take once a day, and the hope is that this daily pill could potentially reduce the risk of acquiring HIV.
And the hope is if you can eliminate people getting HIV, then they don't progress to AIDS, which basically means you're getting sick with HIV-related diseases.
Yeah, so for people who already have HIV, these medications, Truvada, one of them, is used for HIV treatment to drive down the amount of virus in the patient's blood.
Because the virus is what makes people sick.
The virus is what makes people sick.
It destroys your immune system.
Exactly. And so the goal there for treatment is to drive down the virus and prevent them from developing health problems in the
Right.
future. What we're talking about is something different, and that is preventing people who don't have HIV from getting HIV in the first place. And
Okay.
our hope is that this medication could play a role in reducing HIV infections.
So theoretically, someone who's incredibly healthy, they're negative, they have no diseases, they have a sexual encounter, and they happen to have sex with someone who is infected, and they think that they might have been exposed. This is going to get close to that window period of infection. So they come to the DPH, they say, I might have been exposed to HIV. Or I was stuck with a needle. It could be a nurse working in a hospital with a needle stick, which could happen. And they're freaking out, and let's just suppose that they qualify for the study. What happens next?
So what you're describing is when people have a high-risk exposure, that they might be eligible for PEP, or post-exposure prophylaxis. And the idea behind PEP is that after a high-risk exposure, if people start anti-HIV medicines quickly, and typically we recommend within 72 hours of the exposure, and continue taking that medication for 28 days, that might help reduce their chances of getting HIV.
It just knocks it out, hopefully.
We hope.
Hopefully.
And CDC, the Center for Disease Control, has provided recommendations for post-exposure prophylaxis for a variety of different types of exposures, including many of the ones that you mentioned.
Got ya.
What we're talking about is actually something different, and it's called PrEP. So it's just an additional letter from PEP. And the idea behind PrEP is that you start the medication before a potential exposure.
Okay.
And you are taking this, in our case we're studying it, you just take a daily pill. And then people may have exposures, and the idea is to continue that medication throughout the period of time. And I think this...
So it sounds like long-term treatment.
Long-term prevention.
Kind of like the difference between the pill and the morning after pill.
Yeah.
Close to that.
Yeah, and we try not to say the morning after pill, because it's actually, even with PEP, it's a 28-day course of medication. It's not just a single pill that you pop. And similarly, PrEP is not an evening before pill, but it's actually a pill that people...
It's not a cure.
That's correct.
It's definitely not a cure, but it's a pretty good jump from where we started off.
Yeah, so we currently don't know whether PrEP is effective or not, and that's the goal of our study. But our hope is that this could potentially be another approach added to existing prevention strategies that people are already using.
Okay, and all this information is on your website at prepsf.org?
That's correct.
Okay, and this study that you're conducting, where else is it happening? Is it just San Francisco?
No, the exciting thing about this study is that it's a global study. It's happening around the world.
It's international.
It is, yes. So in the U.S., we have 2 sites here in San Francisco and also in Boston. The study is also taking place in South America, in Asia, as well as in Africa. And what's really exciting is that the study will be studying 3,000 men who have sex with men all around the world. And in many of these sites, it's the first time that this group is really being engaged in research and involved, and so it's really exciting.
Okay. Why the focus on men having sex with men? I mean, HIV can be transmitted in a number of ways. Like I mentioned, needle sticks, hemophiliac still?
Very rarely.
Very rarely, because of the the development of blood products.
Yeah, and our testing has been really advanced so that we can detect infections in blood products.
And who's collaborating with the study? Is it the National Institute on Health, CDC?
So the PREPARE study is being sponsored by the National Institutes of Health.
Okay.
So your question, why men who have sex with men?
Yes.
So men who have sex with men are a population that have really been heavily affected by HIV and AIDS in the U.S. as well as around the world. And there have been a number of studies showing that the number of new infections that are occurring are also happening in this population. And so we feel that it's a really important population to be involved in the studies, and we're excited that this study is going to be taking place in so many different countries. I should mention, though, that there are other PrEP studies being either planned or underway already in injection drug users, as well as high-risk heterosexual men and women.